Hello, I'm Dr. Asif. I'm a surgical oncologist at Manipal Hospital, Dwarka. Today we'll be speaking a little bit about esophageal cancers. Esophageal cancer is also known as cancer of the food pipe in layman terms. In India, it is the sixth most common cancer. It affects almost 65,000 new patients yearly and leads to around 40 to 45,000 deaths annually. Although no part of the country is immune from this disease, but it is more prevalent in northern and northeastern states of the country. Now, who are the patients at risk for this disease? Patients in their 6th and 7th decades of life, male sex, those patients who consume alcohol, cigarette smoking, obesity, long-standing gastroesophageal reflux that is not treated, poor nutrition, lack of dietary fiber, smoked food, hot beverages, all these contribute towards the development of esophageal cancer. Now the patient presents to us in the OPD, he may have slight heartburn or a retrosternal discomfort, but more typically, patients present to us with dysphagia that is initially limited to solids, but later on extends to involve the intake of liquids as well. Patient may have unintentional weight loss, altered blood in stool. At later stages, patient may develop a change in character of the voice. Patient may have episodes of choking or coughing every time they intend to swallow something. When the patient presents to us with any of these symptoms, the diagnosis can be confirmed with a simple office procedure, an endoscopy. Once the diagnosis is confirmed by biopsy, a staging workup is required to know the extent of the disease. That is usually done with the help of a CT scan or a PET scan. Once we know the stage of the disease, next comes the treatment. Now the treatment of this disease depends upon the location of the tumor in the esophagus, the stage of the disease, and overall physical condition of the patient. Patients who have very early stage disease can be treated with surgery alone and may avoid radiation and chemotherapy. However, by far most of the patients will require a course of chemotherapy or chemoradiation before undergoing surgery. Some patients who have disease limited to the uppermost segment of the esophagus will have treatment done only by radiation and chemotherapy without the requirement of surgery. Those patients who are not fit for surgery can be treated with chemotherapy or chemoradiation alone. मुझे बीच में कोई मैं सारी चीज़ें बोली इसमें